Hi, it's Dr. Kowalski with Kowalski Chiropractic, and today we're going to talk a little bit more about what we can do to help with foot pain or ankle injuries and some things like that. So in the last video I showed some of the chiropractic adjusting we can do just to make sure we get the foot moving well. And what this video I'm going to show you is our laser therapy. What this does is a few things I'll show you, but before we get started we got to make sure we put our safety glasses on, so I'll have Selena put those on. And I'm going to put these on. And so with the laser therapy, there's a few different things that it does. Step one is it just helps with the pain and inflammation. So say you have a sprained ankle or plantar fasciitis or some kind of inflammatory response that we're wanting to kind of get calmed down. This laser therapy is going to help with that. And the other thing it does is if there's a damaged tissue like a sprained muscle, sprained ligament, what it does is it helps it heal up faster by giving the mitochondria in that cell some good ATP, help that regenerate and make healthy new cells. So it just, in simple terms, it just increases the healing time and speeds it up. So if you have an injury, it just makes it heal up faster. So I'll kind of show you what it looks like here. We just got this laser therapy. When I hit this button, it'll turn it on. And you can hear that beeping sound. That means the laser's going. So I'm just going to kind of start on the bottom of her foot here, and what she's feeling is just kind of a gentle warm heat. So if she had plantar fasciitis or some kind of foot pain, we see really good results with this laser therapy. Just helping that heal up and helping with the pain and inflammation with this. So usually a treatment lasts maybe 10-15 minutes around that time. We can usually kind of knock out both feet at the same time if needed. With acute injuries like sprained ankles, if it's really swollen and inflamed, it's pretty amazing some of the results we see. Ankle all really swelled up, and after about 10 minutes of this, a lot of that inflammation and that swelling really goes way down, and that makes the ankle feel a lot better. So like I said, what she's feeling here, just gentle warm heat. This treatment feels really good on the feet, and especially if you have a lot of foot pain, arthritis, things like that, this is a great treatment for that. So that's one treatment we can do on the foot here. And I'll take these off. I can take those from you. And another treatment we do for just a lot of muscle injuries or pain is it's called the active release technique, or ART. And it's just kind of what we're doing is gently stretching out the tissues and the muscles in the foot or whatever area we're working on. So with this technique, what I'm going to have her do is kind of start the foot kind of down like this, and then she's going to just extend it up just like that. And while she's just kind of doing that over and over, I'm going to be kind of stretching all the muscles and the ligaments kind of at the bottom of the foot here. So I'll have you just kind of start it curled up and then open it back up. Nice and easy there. And this is just another gentle way, just to kind of, if you have like a plantar fasciitis kind of symptom, or just different foot pain, that what we want to do is just gently kind of stretch these muscles and ligaments out and get that foot moving good. And so we're just kind of putting that foot through the range of motion, just gently stretching that bottom of the foot here. And we'll kind of work these for about another 5-10 minutes or so, just kind of get everything moving well. Just kind of showing you what that looks like. So we do that over on both feet if they needed it. And kind of the last kind of soft tissue or manual therapy we do on the foot is called gua sha technique, and it's using this kind of black fish looking tool. And what we're doing with this, I probably wouldn't do this on like an acute or a new injury, but it's more for kind of chronic injuries. So say she has had chronic plantar fasciitis or really old injury, and we're trying to kind of increase that healing and kind of get some good blood circulation going through that tissue to help it heal up. So what I'm doing here, just put a little lotion down, and we're just gently kind of stripping out this tissue, gently working that tight spot or painful spot up and down. And again, I probably wouldn't do this on a new injury because it can be just a little uncomfortable, but if we're trying to work out kind of an old injury, increase that blood flow circulation, just to help everything heal up a little bit faster. So just a few ways we can help the foot out here. If you've been struggling with feet pain or foot pain, and you're trying to find a place that you want to start, this would be definitely a great place to start before you look into spending a lot of money on expensive orthotics or even injections or surgery. If we can kind of get the foot moving well, get all the muscles and ligaments kind of healed and up properly, this would be a great place to start with your feet pain. And so this is just a couple of techniques we can do to help with the muscles and ligaments of the foot. And in our next video, I'll kind of show you some of the exercises and some other things we can do to keep the feet nice and strong, so these injuries don't come back and the pain doesn't come back. So that's it for today.